Thank you for joining me today. Last time we discussed maternal mortality and we found some of the causes being infection after childbirth, high blood pressure during pregnancy, and childbirth related complications as well as complications from unsafe abortions. We also found that having a skilled attendant, healthcare attendant, work with you during the antenatal period, uh, during labor and delivery, as well in the postnatal period are very key in helping to manage and also prevent some of these complications. Today, I would like us to discuss how to prepare for pregnancy. Well, being aware of your medical history as well as your family medical history can help to identify potential risk factors that could affect or be aggravated by pregnancy, and it would also help to inform your antenatal care plan. So kindly feel free to explore this with your healthcare provider, and they can walk the journey with you in a more informed manner. There are certain lifestyle practices that could also impact the growth of your baby. For example, smoking, use of alcohol, as well as use of illicit drugs. So if you're planning to conceive, it will be worthwhile to consider withdrawing from some of these things so that you are at least ensured of a healthy baby. There's definitely certain medications that could impact the growth of the fetus. So if you're on any medications or any supplements, explore this as well with your healthcare provider and see what can be adjusted or what needs to be discontinued as well. There are certain conditions, chronic conditions that could be existing already, maybe, or there's a history of the same as earlier mentioned. Things like diabetes or high blood pressure or epilepsy. These will need to be managed effectively before becoming pregnant. Well, weight management is also important. It will not only improve your overall well-being and give you a more comfortable pregnancy experience, but there are certain issues that are related to weight. For example, obesity, which comes with its complications as well in pregnancy, like gestational hypertension, preeclampsia, gestational diabetes, and also a large for gestation infant. You know, uh, a low being underweight as well can also come with its own complications. So work towards gaining and maintaining a healthy weight. The value of nutrition cannot be overemphasized. You and your partner can work towards a balanced diet. uh, there are certain essential nutrients, for example, iron and calcium and folic acid as well, which are necessary for your diet if you're planning to conceive. Folic acid is the man-made version of vitamin B9, also called folate, and it's helpful in the formation of red blood cells, and it also helps to prevent certain birth defects like neural tube defects, like spina bifida, which can affect can develop in the fetus because of the lack of folic acid. Um, of course, a well-balanced diet that includes, vitamins as well. There are vitamins. Vitamin C, for example, helps with the absorption of folic acid. It is available in fruits like oranges. So explore with your healthcare provider what are the foods that are readily available in your local vicinity that would need to be considered for a healthy and a balanced diet. Other lifestyle considerations are things like exercise. Exercise is important, not only management of weight, just preparing your body for the challenges of pregnancy. If you have an existing exercise regime, that is good. If not, maybe consider beginning simple, but at least aim at maintaining, a consistent regime. Things like walking and swimming can be helpful. Stress management is also very important. Stress can impact fertility. Therefore, learn stress reduction techniques that work for you. Sleep is also key, to give you rest and just, get you well prepared for the journey of pregnancy. Genetic testing and counseling is also important. It helps you understand how genes, birth defects, and other medical conditions run in families and how they can affect your health and your baby's health. So explore this again with your healthcare provider or find a genetic counselor that could help you discuss and identify any potential risks. Well, that's it for today. Thank you for taking time to listen in. Um, I hope you can join me again in the next session where we will explore some myths and facts related to pregnancy. Thank you.